In 2006, we began to change the way we approached research in healthcare. Thanks to the support we've had, we have grown from strength to strength. Over just 5 years, we saw an incredible increase of over 700% in the number of people involved in our studies. We participate in national studies and we create our own local studies. More and more clinical areas are getting involved to help develop new treatments, prevent illnesses, and improve the quality of life for people living with medical conditions.
I think research is incredibly important. Obviously, research that's done outside of hospitals is what sort of pushes forward medicine, but it's very, very important to actually do research in the real world.
I think patients like being involved in research. Something like 90% think that yes, it's an important function of the NHS to be involved in research. So the study that we were looking at made a difference, and that's a huge difference from the study. But sometimes it's not the studies you think are going to make a big difference that turn out to be the ones that do. That's part of the attractions of research.
The research opportunities found me in the sense that I was going to the diabetic clinic on a regular basis, met up with all the team, and over time got chatting, and it was mentioned that various research projects take place and they need people to help, and I was more than willing to get involved.
So the Trust and the hospital has been very helpful in helping us to set up some research trials. We're involved in a number of studies now, and because of that we've actually got our own research nurse who helps us not just to set up the studies but also then to provide the care that we provide.
Well, the benefits to me over my previous roles are the fact that I have such a close contact with my patients. I have a lot of time to spend with them, I can answer questions, I can be an advocate to them. I work closely with the consultants, and it's just a very holistic role with the patients, because you are with them from the very, very beginning of the trial to the very, very end, and beyond that as well.
I signed up to do whatever was required, but got involved primarily in 2 studies. But the reason I would do it is, firstly, because I think I should give something back to the community that's helped me for the last 30 odd years. I mean, as a diabetic, I get a lot of help, a lot of attention, so I do want to give back. So yeah, I would always want to do that.
So I became interested in research partly because of the exposure I had while I was training, but also because of a desire to try and improve the service that I'm providing to my patients here.
So the patients will get far more one-to-one time with a nurse. Most of us specialise in an area of research, and that gives us a very broad knowledge base of that subject. So we can give information, we can give advice, and so when someone comes out of a clinic appointment, they can come to us and we will go over it with them.
Research is incredibly important in trying to push the boundaries of medicine and science, and it's important to research in laboratories, and it's incredibly important also to involve the patients in research. But ultimately, the people who benefit are our patients, not just the patients who are involved in the research, but also the patients who we see outside the research trial.